Recording starting now. We got Heiner Fruehauf in the house at UNM, PhD, LAC. You all know him and love him. Let's let him take it away before I lose connection for the 5th time in as many minutes.
Hi, everybody. So good to be with this, while it's not live in person, but virtually together with everybody, with the community at this moment in time that I personally find very crucial for our profession. I want to thank Ross and the OAAOM for inviting me here to share my thoughts and limited experience with, I should say probably viruses in general. I've as somebody who's not only suffered from cancer a long time ago, but also from myocarditis, which is a viral affliction to the respiratory system that then goes deeper and afflicts the heart. And then my own clinic, starting originally working for ITM, together with Subhuti, being involved in the treatment of HIV and AIDS patients. And my own clinic, I have a lot of people with Lyme disease and Epstein-Barr virus. And so I've always been interested in the treatment of viral diseases with Chinese herbs, and find that while Western medicine, that's a strong weak point of Western medicine, perhaps that there is, despite all of these methods to work with bacteria, etc., when it comes to viruses, is harder to work with. Whereas, so I think Chinese medicine is very much that is the domain of Chinese medicine. I've been very busy the last 2 weeks due to my, I call them family relationships, because I'm very close to my teachers over there, and then some of the colleagues. So I've been in contact also through the employees and the herb company, been sending me materials about how treatment, the situation in China in general, but also what kind of Chinese medicine methods they've been employing. And very clearly, we see that now after several months of that, the Chinese, this is one of the advantages of the TCM system, that there are literally millions of people licensed and working in that system, including researchers, so that data is being put out in published form quite early. So I've been putting together things on a COVID-19 dedicated page on classicalchinesemedicine.org to make that available for our profession, just to see mostly translations from China, from inside of the hospitals, from people collating information from the whole country. So some of the things I'll talk about today will be, what I personally learned from those reports. And overall, I want to call the presentation title tonight, "The Role of Chinese Medicine in the Prevention and Treatment of this Novel Disease." What does Chinese medicine have to offer, other than these very concrete materials that I'll be sharing with you in detail in a moment? There is, of course, as my dear colleague, Dr. Liu Lihong, has repeatedly pointed out in the course of this epidemic, is that Chinese medicine has a long history of treating epidemics. In a certain way, we could say that the main purpose of Chinese medicine was originally treating epidemics, and classics like the Shanghan Lun should really be translated as a discourse on epidemic diseases caused by cold and other miscellaneous factors. Because that was when, in the preface to the Shanghan Lun, of course, Zhang Zhongjing is stating that almost 2/3 of his extended clan had died, and the methods to him getting involved in medicine because of this, and the methods that he's collated over time to treat the disease at his time are written down in this book called the Shanghan Lun. In the Shouwen Jiezi, one of the earliest dictionaries that the Chinese have, I don't know how that would be translated, the explicating single characters and complex words from the 1st century or so, there is a word in there, it's called yi, and that means epidemic pestilence. And that word in there is defined as min jie ji, which means all people are getting sick from this, or it is a word for disease when not just one person gets sick, but everybody gets sick just the same. Furthermore, of course, in the Huangdi Neijing, there are entire chapters devoted to specifically epidemic disease. And in there is stated that there need to be particularly the chapters 69 to 74, where the Wu Yun Liu Qi, the weather patterns in there states that there are particular weather patterns that are particularly fertile for the development of something that's called Wenbing, the febrile diseases or E of epidemic types of diseases. So there was already quite some accurate statements in there that really astonishing, considering that they're from thousands of years ago. And as my colleague Brian McMahon pointed out in an article that he wrote together with one of his mentors from China, Dr. Li Xin, in one of these articles put up on classicalchinesemedicine.org is the analysis based on Neijing statements about the end of last year and the beginning of this new year, and why there's a combination of particular factors that made it more likely for an epidemic, particularly in the respiratory tract, to start. Very nice analysis there with the, basically the main cause of epidemic in the Neijing is that when there is unseasonal qi. So when the winter that's supposed to be cold is warm, and when the spring that is supposed to be warm is cold, for instance, and that is precisely what we've been seeing, is that the winter was much warmer, not just temperature-wise, but energetically. The year of the pig, right on the organ clock, goes with the Shaoyang position of the triple warmer, and then this year follows the Shaoyang position of the rat, like the times equivalent to the times from 9 to 11 p.m. and then 11 p.m. to 1 a.m. Where the holographically is the time of the triple warmer and the gallbladder. And so that is sort of like the bottom of the kidney. We can look at this at the very bottom of the year, when the job is to draw the yang qi deep down. And contrary to that is the yang qi was not being able to be stored, and that is why it was so warm. And then while there were people a week ago already running around in t-shirts and swimming in the Sandy River close to where I live in out in the gorge in Corbett, the last few days we had hail. And so this is, already April now, but it's still way too cold unseasonably cold for this time. So the Neijing already has observations about that. And then, of course, the Shanghanlun itself is making more than just some theoretical statements, but is very systematic in not just disease in general, but we can look at the Shanghanlun as progression of epidemic disease, particularly the epidemic influence at this time was more cold than this one we're having right now is mostly damp as being the main pathogenic influence. We'll talk about that in a minute. And then, of course, we have all of these later classics that then led into what we know as the fever school starting 400 years ago with a man called Wu Youke, who wrote the Wenyi Lun, the discourse on epidemic pestilence, basically discourse about how to treat the bubonic plague, cholera, and all of these febrile epidemic diseases. It's just like SARS and COVID-19. And then, of course, the later official founders of the fever school, the Wenbing, Ye Tianshi, Wu Jitong, etc., from just 250 years ago or so. Still Shanghanlun based, but preferring different kinds of herbs for the most part. So we, from the role of Chinese medicine is such that, to summarize again what I've said so far, is that from the materials we see coming out of China, if we ourselves, and this is mostly what I see my role as today, is to give ourselves the confidence that in a certain way, this is business as usual. Everything else seems different. People are scared, highly unusual circumstances. But in terms of diagnosing this disease and treating it, it is not different from anything that we've learned. It's not outside of the parameters of yin and yang. It is not outside of the further differentiation of the 3 yin and the 3 yang, the Liu Jing Bianzheng and the Shanghanlun progressions. And we have, our profession has something that works and for this disease, and we should participate in helping everybody we know, friends, families, and patients to stay healthy, or when they get sick, helping them get better, because our medicine can achieve that. Secondly, long history that we just went through of specifically having not just here's this weed, here's that pill, but a real theoretical outline on how to deal with incredibly prolific, many thousands of years of multiple works written specifically about epidemic disease. And then, of course, as Deng Tietao, we had the honor of meeting in 2006 personally when he was still alive. He was already 90-some at that time, and he only passed away last year at the age of 103. One of the respected Silao, 4 elders of contemporary Chinese medicine, who was the lead Chinese medicine clinician in the SARS epidemic in 2003, which is, of course, also a coronavirus, very similar. And he showed at that time already when death rate was devastating, similar to coronavirus in Italy, over or around 10%. And the Western medicine modalities didn't work, other than the quarantining, of course. And so he started toward the end of the epidemic, he got the green light to head a team to treat people with Chinese herbs. And he achieved the 3 nothings, namely no death in his ward, no transfer of patients to other emergency wards because nobody got worse, and no staph infections because people were all prophylactically taking Chinese herbs. And so one of the things that just got posted yesterday is an article by several researchers from Shanxi University of Traditional Chinese Medicine and Pharmacology, entitled A Discussion of Traditional Chinese Medicine Diagnosis and Treatment Approaches to COVID-19, based on the experience of Chinese medicine expert Deng Tietao during the SARS epidemic. And they're doing a good job in there in synthesizing his entire philosophy and what kind of herbs he was using for a very similar type of disease. But the reason why I mention it here, point number 3, is what is the role of Chinese medicine, is that Deng Tietao always said Chinese medicine is not based on germ theory. It is based on syndrome differentiation. That means we don't need to wait for some lab to tell us that what the name or label is of a disease and what kind of chemical compound has a chance to destroy that. But the minute a patient comes, we're able to treat that. And that is particularly important. And that's what I want to talk about today is, of course, all of us, myself included, are finding ourselves in a situation where our worried patients are calling us and saying, I have symptoms, I read on the internet, I lost the sense of smell, I have the dry cough, I feel body pain, and I think I have this. And we're not sure, but it doesn't matter for us. We don't need to have a positive test in order to treat, or treat it completely different. If there is a positive test, we can immediately start treating based on the knowledge of this particular quality of this pathogen and the constitution of the patient, etc., on this syndrome that they are manifesting at. So, I mean, this is something that is puzzling, right, at the moment, is that there are so many people sick, and lots of them don't know. They said, I haven't traveled, I haven't been in contact with anybody who's been traveling. There are, just washing your hands or so. That's great. By all means, do that and distance yourself. We are following suit here too. Ross and I are appropriately separated by 10 feet distance here, and stuff like that. And so by all means do that. But, we don't really, there's really very little knowledge about how, what mechanisms this particular virus, and maybe others as well, and spread in the population. So meaning, just a reminder to all of us that our medicine is a science in its own right, and we do not need to wait for Western medicine to determine or have a cure, but we can immediately treat. And if we recognize the syndrome correctly, we can expect immediate results. Okay. So let's take a look at what particularly coming out of, since the Chinese were several months ahead of us over here, we over here only now starting to see patients. Of course, we may have seen plenty of people 2 months ago already that had this, but nobody was necessarily thinking that it might be this virus. So maybe you have direct experience, but let's just assume that over there in China, they have more direct experience at this point. And so let's take a look at the materials that I've seen coming out of China so far. The important thing to realize, to summarize, particularly Wu Youke's theories in the Wenyi Lun, the treatise on epidemic pestilence, is that normally when we look at the patient, it is including the regular flu, whether somebody gets diagnosed, gets Yinqiao-san for a wind heat affliction, or gets Gugentang or Guizhijia Gugentang for more wind cold affliction, is a lot determined by their personal constitution. And the specialty about this kind of yixie, as it's called, this kind of pestilence, this epidemic toxicity that seems to be in the air all around us, plays a much more dominant role in an epidemic. And therefore, people in ancient times felt emboldened, rather than insisting I need to see every patient directly. I can boil up a huge cauldron of material in the village square, and everybody drinks the same thing, and we can assume that little harm is being done, and most people are only going to benefit from such an undifferentiated approach. And that is possible only because in this alchemical fusion of the patient's microsystem with the cosmic cold, damp, heat, whatever influences, and then fusing together and forming the syndrome that we then diagnostically assess and then match with the right remedy, very much like a homeopath would also look at their patient and say, that's a belladonna. We would say, this is a Taiyang syndrome, therefore I use Guizhitang, for instance. That the assessment of the nature of this particular epidemic pathogen out-dominates individual constitution. It's almost a little bit like when women get pregnant, and regardless of their constitution, 90% of them, is at least my experience during the first trimester of pregnancy, require administration of Dangui-san, Angelica sinensis powder, to tonify growth of the fetus correctly, to keep the mother healthy, and to prevent miscarriage. So this is the same, is that there is an incredible similarity that we've experienced, whether those people have coronavirus or not, but in these people that come in with pneumonia and these very asthmatic types of cough patterns into the clinic over here, as well as in China. And a lot of them get very similar kind of remedies, highly unusual. So the nature of this pathogen is such that that it is complex, that there are lots of different factors coming together with number one, starting out with cold. Okay? It's the cold, not so much that people have a Taiyang syndrome and necessarily feel cold, even though I think I heard this morning Andrew Cuomo's brother, who's some kind of TV personality, has that virus, and just 2 days ago had 103 fever, and he said he chipped off a piece of his tooth because his teeth were chattering so hard at night when he was hallucinating, having 103 fever, but he felt cold, and his teeth were chattering. So there is cold influences, and it's very important, therefore, to not jump the gun and immediately prescribe Huanglian, Banlangen, Daqingyi, those kinds of things that we think of as antiviral that are not diaphoretic, which is important in the early stage, and even for prevention, we need to have some wind herbs to kind of enforce the surface there. And like in my line of thinking, very often for pneumonia, once things go internally, the heat clearing really becomes important. We, in the classical pearls line of products, often use dragon pearls, where you have all the yellow herbs, you have zhizi, you have qingdai, indigo. in the last 2 months, I don't think I've once even used dragon pearls or huanglianji du tang and daigesan, which are at the heart of that remedy. So meaning you no matter what you do, you want to make sure you're not harming the yang qi of the spleen and the lung, because that'll backfire. Then perhaps most importantly, whether people were pointing out cold or heat later, or stagnation or toxicity or deficiency, everybody agrees that the most important characteristic of this pathogenic factor is damp, including this, in a certain way, and this has been verified by a pathology, rather gruesome pathology report I saw coming out of China, where they autopsied more than 100 patients who died from this disease. And you could see, and replete with pictures, and you saw that this kind of rubbery, literally rubbery phlegm that people were having a hard time coughing up is not coming out. So people saying, I have a dry cough, well, it's actually, there's lots of phlegm obstructing the airways, but it cannot come out, and that's why it seems that it's dry. Actually, when people then get blue lips, etc., it is very much because of phlegm globules are obstructing the airways, and then particularly qi deficient patient, like older people, don't have the strength to eject that, and then literally suffocate to death. And I should say that at least one pathologist was warning and saying that the excessive application of oxygen and use of respirators in the hospitals for more severe cases is actually looks like may have contributed to, rather than giving the phlegm a way out, pushing the phlegm deeper into the lungs. Okay. Well, while Western medicine has a really hard time with these kind of phlegm obstructions, this kind of phlegm has a name in Chinese medicine called shitan, which is called damp phlegm, which is this kind of rubbery, kind of obstructive type of phlegm. And there are particular methodologies to make that more fluid and be able to then expectorate that. So there's cold, there's damp, there's heat, because cold always means obstruction. Everything becomes sticky, the qi stagnates, and then things start to ferment and become hot. So at a certain stage, the Yangming heat will rise, but that is primarily because of the damp. And so one needs to be careful not to go in there guns blazing and clear the heck out of the patient with super cooling, bitter kinds of herbs. Very important next pathology here, or characteristic of this pathogen, is du, which means toxicity. Toxicity means potentially deadly, means potentially advances very quickly, like all these, hemorrhagic fevers and all of these Ebola symptoms and cholera, all of it, but also this kind of, nothing in the morning, and then the patient faints in the afternoon. With this disease, that's without du, without toxicity, that wouldn't be possible. And very important, we mentioned it already, is at a certain stage, the stagnation of both qi and then eventually blood. So you hear about, when there's damp, it starts shutting down the qi flow. And when the qi doesn't move, the blood doesn't move. And again, on one side, we know that Western medicine, even for regular heart disease patients, has, uses Coumadin, blood thinners, and that's not a really great remedy to use. Basically rat poison for people who already have failing liver and kidneys in this particular case. but they finding, that there are all of these obstructions, including blood obstructions and blood clots in these people who all of a sudden experience massive shutdown of organs. So for every single piece here, Chinese medicine has a conceptual idea of how to address that. And that is the important thing I want to emphasize, at least in my talk. I don't want to say, use this remedy, this is the magic bullet, but it is more about the once we have a concept, then there are many, many different remedies to choose from. Another piece I want to recommend right away for everyone to read. It was also the one where we put the most time in. It was like a team effort of 2 or 3 people working, translating, and then putting it into PDF form, etc., putting up online for 4 or 5 days or so. Is this one, the role of Chinese medicine in the COVID-19 epidemic, is basically the transcript of a 2-hour talk by my friend and colleague, Professor Liu Lihong, who wrote that book, Sikao Zhongyi, Classical Chinese Medicine, that came out last year by the Chinese University of Hong Kong Press, and who is by now retired, but has its own platform for the promotion of particularly classical Chinese medicine principles, called Tongyou Sanhe Foundation and Academy. And so he's been extremely active and tried, even though he's in his 60s, to go to Wuhan right from the get-go with the team, wasn't allowed to. And so this piece, this of the 2-hour lecture here, is is sort of a, I don't want to say entertaining, of course, this is not the right word here, but it is an oral narrative that walks us through, how difficult it is for somebody who's not sent by the government to, when at a time when it was all hands on deck. And he is arguably one of the top 2 most famous Chinese medicine doctors in China, how difficult it was for him to be allowed into this, into one of the COVID wards in Wuhan. So he finally got there, and then treated with 2 other colleagues of his who were administering both acupuncture and herbs at the same time to both the Western medical staff as well as to the patients, and then had a very positive experience, because he had issued certain opinions from a distance, but then felt much more confident. And of course, at a moment when you've gone in there and put your own life at risk for the benefit of the profession, he was, of course, at in a position where he where nobody was then criticizing him, and he was then invited by one of his alma maters. He got his bachelor degree at Guangxi University of TCM, his master's degree at Chengdu University of TCM, and then his doctoral degree with a thesis about the Shanghanlun from Nanjing University of TCM. And so his alma mater in Chengdu invited him to speak per video conference from his hotel room in Wuhan at the end of his stay there, after 1 month, when he could speak from clear experience how Chinese medicine works for this disease. And so he had the entire faculty, the entire students, tens of thousands of them, in Chengdu listening. And then at the same time, 2 of the largest or 3 of the largest Chinese medicine continuing education platforms hooked up all at the same time. So he really milked that opportunity for all it was worth to, in no uncertain terms, tell his own profession and saying, it's like, stop not believing into your own medicine, But this, I can unequivocally say that this is working. You know, the immediate relief with acupuncture with people who couldn't breathe, and if you can't treat directly, then from a distance with herbs, people do respond to particularly he is of course Shanghai Lun practitioner, so he was coming from a Shanghai perspective, but, and this is why I'm mentioning that, he was extremely diplomatic, not only toward Western medicine, not going like Western medicine doesn't work and ours really does. I think that was a good position to take at that moment in time, of course. And then secondly, he was also trying to pacify these arguments between the different herbal camps in the Chinese medicine profession. You know, he says it's not like using this formula is the right one and being fever school is the right one versus Shanghan is the right one. It's basically everything we've seen is very much, it's that the concepts are the same, and then people, once they understand that it is what he calls complexity syndrome manifestation, this particular virus in most people, then whether what remedy you use is absolutely secondary to that. So I thought that was a very, you know, he did that very diplomatically in there. And then, of course, at the heart of his analysis is what is the nature of this disease. And he says, he reminds us, I had forgotten that myself, that preceding the Taiyang chapters in the Shanghai Zabing Lun, the discourse on disorders caused by cold and miscellaneous diseases, there is the chapters we normally flip through, if they're translated at all, they call Shanghai Li, meaning examples of Shanghai epidemic disease. And in there, it points out that in the case of epidemics, you don't have this neat progression from Taiyang, finishing, going on to Yangming, finishing, going on to Shaoyang, finishing, going into the three yin channels, or through one, then the other, and the other. But that there is right away a simultaneous affliction of two, if not all three yang channels at the same time. And so that is, I think, the most important thing for us to, from a conceptual perspective, to see that and in the Shanghai Lun itself calls that 合并. I translated that in this piece of paper as complexity syndrome. You know, that, and then at the same time, most likely, and I think that piece is particularly important, not only the Taiyang and the Yangming, meaning external cold plus internal heat in the lung and in the stomach, potentially also the large intestine become involved, but that also Shaoyang stagnation and heat and going toward a deficiency leading into the three yin syndromes is involved. I personally think that in the year, particularly at this junction of going from the year of the pig into the year of the rat for this, because of this Shaoyang positioning there, it's particularly, I see almost everybody who has got symptoms has Shaoyang signs and needs to be treated right from the get-go with Chaihu remedies. More about that in a minute. He furthermore, so he says in that Shanghai Li chapter, Zhang Zhengjing tells us epidemic diseases start complex as 合并, meaning we have two or three diseases that don't progress from one to the other, but simultaneously, right away, it's a Taiyang Yangming Shaoyang complexity syndrome, and needs to be addressed, all three of those at the same time. he used as an example, because this is, of course, how do we know that Chinese medicine works, and why am I willing, as somebody who, hasn't in a certain way, even the people were in my heart, I'm certain they have this disease, even those have not been able to get tested in the state of Oregon because of a shortage of test kits, that they, let's see here, just lost my train of thought here. Let me drink a sip of water here. So, yeah, that all three of these, the reason why I feel confident speaking here is because there is something, and this is, of course, China in a certain way is a much more dictatorship-based country than over here, which allows them, of course, has lots of negative ramifications, but it allows them to issue things, edicts, that everybody in an emergency situation then needs to follow. And so one of them was that they issued right away, and they updated this all the time, treatment protocols. And by now in the 7th or the 8th edition, and edition number 1 was Western medicine only, edition number 2 was Western medicine only, and then starting with edition number 3, starting the middle of February, so not, it took a while, at least 3 weeks or so, then they started using Chinese medicine. It started adding that in the hospitals. And then there was even mandatory prescription of Chinese herbs at a certain point. And that, of course, wasn't differential diagnosis, but was one government edict formula that's called, for the most part, in most hospitals they used. And that's what the studies, that show there's 90% success rate, etc., is called Qing Fei Pai Du Tang, is clear heat in the lung and eliminate toxin decoction. And it's this incredibly complex remedy that consists of Ma Xing Shi Gan Tang, She Gan Ma Huang Tang, Wu Ling San, Xiao Chai Hu Tang, plus some other herbs that are added in. So it is basically a remedy that combines not just the 3 yang, but even has like elements of Tai Yin in there as well. And so he is, even though he wouldn't ever think of using such a remedy, he kind of says, this is the reason why this has been working, even in an undifferentiated state, administered by people who are not trained Chinese medicine physicians, technically in a Western medicine hospital, is simply because this is a complex disease, and we basically fulfilling these guidelines that Zhang Zunjing had outlined in the Hebing and Bingbing, the dual affliction, or the consecutive affliction, let's call that, which is Bingbing is different from Hebing, is that normal disease progression in the Shanghai illness, in, let's say, a regular flu, Shanghai disease, a Taiyang disease turns into Yangming disease turns into Shaoyang disease, Shaoyang disease turns into Taiyin disease turns into Shaoyin disease progresses into Juyin, etc. And here we have Hebing complexity syndrome. 2 out of 3 yang diseases happen right at the same time, or all 3 of them start at the same time. And Bingbing, this kind of simultaneous disease affliction syndrome is that we're starting with Taiyang, and then instead of Taiyang being finished, it going on to Yangming, the Taiyang lingers, and now it's Taiyang, Yangming together. So very similar to the complexity syndrome, Hebing, but there's a temporal sequence there. And then finally, he says there is something that Zhang Zhongjing points out that's called Yanggan dual affliction, meaning yin and yang channels simultaneously involved, particularly with the people who have diarrhea, as we hear, have lots of digestive symptoms in the hospitals where the Taiyin is involved. That's why we have difficulty, even now in the United States, buying herbs like Baidoukou, Baizhu, Cangzhu, Houbo, that are technically, enter into the Taiyan channels, warm the spleen, dry damp, etc. So he gives us a very good direction there, and at least a format through, or a lens through which we can understand all of this information that we put up then at the classicalchinesemedicine.org website, COVID-related information. So we have I already mentioned the Deng Tietao's protocol for SARS that then got translated by the Shanxi University team, updated for this novel coronavirus that we have right now. And their suggested formulas. We have furthermore the interesting paper coming out of Shanghai, the dampness epidemic, exploring the clinical characteristics of COVID-19 in Shanghai. This was a long paper that had like all of these TCM stage 1, these symptoms, use these remedies, next stage, use these remedies. Since I had already translated another paper earlier than that called Expert Consensus Statement on the Prevention, Diagnosis, and Treatment of COVID-19 Infection in Children, that has a very detailed outline that is not just for children, but is basically following government recommendations of what you use in the early stage, middle stage, severe stage, recovery stage, and all of these remedies can also be contemplated for use in adults. So we having, but it's really in a certain way the plethora of information that also people in China were overwhelmed with, even people in the profession. And so I think Liu Lihong has a very clear guidance here how to look at all of this information and what direction to go in. I particularly, the important thing is that this disease needs to be treated in stages. Okay, it's not one formula and then everybody takes that, and then throughout the entire process, but that there's basically, you feel getting a fever, you have your prevention remedy ideally stops it right there. You never even get sick, or even if you're a carrier, you never get symptoms. Then early stage, you're getting a sore throat, you start coughing, having a fever, etc. And then ideally, and this is the strength of Chinese medicine, we can expect that with relatively simple approaches, where we don't need to choose from thousands of different remedies, but just a few, we can prevent the disease ever to go on into the severe stage, where, because, we've heard that, it's uncomfortable, but as long as you have mild flu symptoms, it's not that big of a deal. It's just once you can't breathe and have these obstructive issues, that this an organ failure, that this will become an issue. So that's where the role of Chinese medicine is treatment in these preventative and early and middle stages of the disease before it even gets to the severe stage. And while we see that Chinese medicine even there has ways to successfully treat, most likely, those people will then be in the hospital and on respirators, and there's no way in administering any Chinese herbs at that point. So the stage treatment, complexity of the syndrome, considering that from the get-go. And then next, maybe a little bit of my own experience, not just from the last couple of weeks when this has started to become acute over here, but really from the last 2 or even 3 months or so, where I feel like we had an epidemic of very severe respiratory infections that immediately would turn into pneumonia, and people saying, I don't know what this is, I'm not getting better. Every time I go back to work, I'll start getting a fever again. So whether that is this particular caused by this particular virus or not, energetically, we are all in the same qi, and therefore are being poisoned by similar kind of energetic influences that then also become similarly severe. Remember that last year we had tens of thousands of deaths from the regular flu in this country, and that's mostly old people getting a regular flu and then dying from pneumonia. So it doesn't need to be this particular virus to have that kind of deadly effect and bring us to an end stage like that. So what have we been using in our clinic so far for that, starting really 3 months ago, and even in December already, is we've been using, like in my regular herbal practice, the go-to remedy patterned after my main clinical teacher, Dr. Zhengrong Xiu, is a remedy called Suzi Li Hou Tang, which means perilla seed benefit the throat decoction. That is the basis then of the perilla pearls in the classical pearl series. And that is basically a remedy that has the benefit when you're not entirely clear. Is it a wind heat, or I need to go the yin xiao san route, or is it a, excuse me, is it a wind cold, and I need to go the, gui zhi jia ge gen tang type of route. But that the minute the patient feels under the weather and starts coughing, has a sore throat, usually the Suzi Li Hou Tang or perilla pearls approach works. But this particular time around, we found that the gu formulas, the thunder pearls and the lightning pearls, which are based on the Jiajian classical remedies, Jiajian Suhe Tang, there should be a paper on the classical origins of those, the Qing dynasty origins of those remedies that are primarily for complex chronic parasite syndrome. But the originators of this formula also stated that you can use it for the treatment of the common cold. And it wasn't until reading Dr. Liu's, or translating Dr. Liu's lecture that I understood why that is, because there is no more, complex approach to the common cold than treating Yangming, at the very least, Taiyang and Yangming together, plus some Tai Yin, and excess and deficiency at the same time, cold and heat at the same time, external and internal at the same time, Taiyang and Yangming at the same time, fits exactly. And of course, there is these, particularly the antiviral and antispirochetal triad that I learned from my teacher, Dr. Zheng, Jin Yinghua, Xuanshen, Tufuling, the honeysuckle, Phonicera, scrophularia, and smilax, is in, at least in the lightning pearl. So I like to use that also for Epstein-Barr and herpes and just these kind of damp, wind damp related type of viruses that also live in the body chronically, tend to be tethered to damp, flare up when the person gets a common cold, etc. So the remedies then used, for the Taiyang Yangming, we've been using also for preventative purposes the thunder or lightning. There are basically two different versions of Jiajian Suhetang, which I think overall, if the thunder pearls, or usually designed for what I call digestive coup, seems to be the most appropriate for most people. And I just been telling people just to take 2, not more than 3 capsules twice a day if they're at home. And if they are still working and out and about or working in a grocery store, then take it 3 times a day, because of the not just diaphoretic, but using sweet and bland herbs like Jinyihua in there, and using internal herbs like Baihe and Huangjing. It is not frittering your zhengqi away if you're taking such a remedy for weeks and weeks prophylactically. So that's an important thing, and it's in smaller amounts, like 1 capsule twice a day, say for children, or even cutting open the capsules for infants. But that's just my, whether you make that up as a granule or so. And again, it's not about a particular remedy. It's about it's about what the Chinese call the fa, the methodology. It's like by studying this remedy, you have a methodology of what kind of places in the body you need to cover. You got to cover the cold, the wind cold, and the wind heat, and the damp, and the internal deficiency, and the toxicity, and the stagnation, the biofilm related aspects of the disease, etc. So in these remedies, Jiajian Suhedang, this is all taken care of better than in just a monodimensional Shanghan or fever school remedy. But, and here is where my personal experience, at least a limited experience with my patients here, differs a bit from Dr. Liu's, simply because as not only a proponent of the Shanghan, and within that the so-called Huoshen Pai, the fire spirit school of Shanghan interpretation, but as a disciple of the Lu family interpretation of that, coming out of Chengdu, they virtually never use Chaihu for various reasons. And I feel the Shaoyang is extremely important in this particular epidemic, and again, using the epidemic term in the widest sense of the word, by including non-COVID-19, but still very severe kinds of pneumonias that are happening right now. And so we've been pairing the Jiajian Suhetang, either individualized in granular form, or in the form of thunder and lightning pearls, with the likes of Xiao Chai Tang, Si Ni San, Chai Ge Ji Ji Tang, even Xiaoyaosan, and not unimportant, Chaihu Guizhi Ganjiang Tang, and or in the patent remedy form, some of these are available in that form, but there's also ease pearls, which is a combination of this, and release pearls, mostly Chaiga Jijitang based, together with the Jiajian Suhetang thunder lightning approach. And that for the beginning stage of the disease, when people just come down, this usually helps to bring down the fever, alleviate the sore throat, be able to get rid of this kind of frog in the throat type of sensation. In the ease pearls, for instance, there's also Banxia Hobotang in there. And only then if you feel like the patient gets further complications, like a really sticky tofu-like tongue coating, and they wake up and they say, I feel like my mouth is glued shut in the morning, and you see this thick tongue coating, then for additional damp heat removal, once again, instead of using Huanglian Jiedutang or so, using cold, bitter yellow herbs or dragon pearls, using Feng Shui Dan, consolidate the marrow pellet instead, which consists of just basically these two herbs, large amounts of Huangbai and Sharen or Baidoko, to not only clear damp, both damp cold as well, then the tendency to turn into heat, but also this consolidate this downward drawing momentum of the kidney that we said was particularly missing at the end of last year because of the Wu Yin Liu Qi climatology patterns there. So, you know, basically with sort of a tool set of 5 different formulas and different combinations, I feel like this is sort of enough for us right now to work with this disease. I should say maybe Yin Xiao San can also go into this thunder lightning, because in the Jiajian Suhetang there is Jin Yin Hua, there is Lian Xiao, theoretically at least. You know, so you have for the you know, Taiyang Yangming over here, and then you want to add the Shaoyang to that. And then very important is to consider to consider the right amount. So while we normally just go like prescribe, I don't know, 5 grams 2 times a day, 6 grams 2 times a day, I feel like for this kind of a disease, this kind of severity, and to bring the fever down, not progress, we need to hit it more with like 6 grams 4 times a day, including, you know, maybe taking a dose at night, or 6 capsules in this, you know, in the case of our clinic, 6 capsules of the classical pearls products I just mentioned. You know, 3 of this, 2 of this, 1 of this, combined, totaling 6 capsules, and then 4 times a day, depending on of course, the body size, sensitivity, and age of the patient. I want to also give us some time for some questions. I just wanted to quickly give you as much as information to begin with, to get it all out there. And then maybe the last comment is that I not only want to give the strong message that Chinese medicine, I believe, works for this disease, but that, you know, this is not just a medical issue right now, but also a political and moral, ethical dilemma that we find ourselves in. You know, is, do we keep our clinics open or do we close them? And I totally understand the need for social distancing, etc. But particularly, while this is still legal, and it is at least right now still in the state of Oregon, to keep the clinics open, we have opted to stay open and take appropriate measures, do teleconferences as much as possible. But for people we feel we need to see for better differential diagnosis and perhaps acupuncture support, then we have them come in and make sure there's never more than one party in the waiting room, let people wait in the car. We wear masks, we have the patient wear masks, doctor wears glasses, acupuncture wearing gloves, etc., hosing everything down with between patients, etc. So we feel like, I feel that this is at a time when there is no healthcare out there, particularly for the kind of patients we see with cancer. This is the medicine that they have, that they can't fall out of care. And then also believe, if our patients, and we give them this message, should get sick, I want them to know that we are in this with them together, and we will take care of them as long as we are legally able to do that. And we have 2,000 years of history backing us up. We have a huge machinery of researchers in China backing us up, and this medicine really works. And I want to let you know that where I stand on this issue. And more than that, I feel like this is a real opportunity for our medicine to achieve, because of necessity, a greater cooperation with Western medicine, and a real opportunity to have the general public take greater, more care of their own health. And what are they going to do? Not people can't become a Western medicine expert, but some simple measures in Chinese medicine you can really teach people in a short period of time. And that's a real opportunity for our medicine, I believe. But let's open up the floor for questions. I've talked enough. I'm sorry if I've been spewing too much information, but it's been a busy last 2 weeks, and I find myself waking up in the middle of the night and thinking about how to translate 和冰, 病病, 凉感, etc. So I'm maybe this restless mind syndrome has come across here, but I hope it's still been somewhat useful for you guys. But let's hear what kind of questions Ross has collected here.
We don't have a lot yet. You guys can keep them coming in. And I want to know, can you guys hear me okay? I'm a few feet away from the mic to keep Heiner safe and myself safe. Just let me know in the chat. Okay, thanks, Aubrey. So I had a question just come through. I'll go ahead and ask that one first. So Lynn Potter has a question. Is there a list of practitioners that are prepared with telehealth technology and advanced knowledge of treating this disease syndrome with Chinese herbs that I can refer my clients to? I live in rural Oregon and do not practice at this level myself, unfortunately. That's an interesting question. I'm not sure if that was meant to be for Heiner.
Yeah, we don't have a list or so, but the purpose of this call is to alert you to the materials that are already out there. Just take a look at that. There is, and then, you are licensed practitioners yourself, even if there is something that I just kind of put together to, for people who prefer to work simpler and not be so complex, work with patent medicines. I put some classical pearls recommendations together that are relatively simple. You should be able to work from that. But if you're still not comfortable doing that, that may be something that somebody could do, is do this work, because right now it's still a little bit quiet, but as we hear, we, by some estimates, will be peaking sometime in a month from now or even later. So there'll be a rising demand for our expertise, I believe. And so now is the time to do this prep work on who's willing and able to do what, and where to refer to, etc. So if there are any volunteers in either the OARM or the schools, or even existing medical teams, I'll try and do the best I can with the folks at classicalchinesemedicine.org to put information like that together. But we're extremely busy just fielding patient inquiries right now and translating stuff.
So, just a little closer to the mic, Heiner. Had someone ask, how serious do you think this disease is on a scale of 1 to 10?
How serious is this disease? I mean, this is, in a certain way, it doesn't matter what I think. It obviously is serious enough to have governments all over the world shut down places, and it may not be serious for a hopefully healthy person like myself, even though I'm pushing 60 at this point, and for most of you, presumably a lot of you younger, but somebody who is severely compromised already with another disease and has multiple autoimmune diseases on top of each other, diabetes and other problems like cancer, or smoked their whole life, then it can become very progressing rather quickly. And that is the bizarre thing about this disease, that some people have nothing, other people just very mild symptoms, and other people then, mostly of the category I just mentioned, then tank really quickly. So, but the question to ask is, does Chinese medicine work for this? And is it any kind of different severity from another disease in terms of efficacy? I would say it's not a more serious disease than something else. It'll respond to the same measures that we normally do. Read Liu Hong's article where he said, I've been a practitioner for 40 years. I'm the lineage holder not only of these herbal traditions, but of this famous acupuncture lineage. And, but when I needled my first patient in that ward, I was afraid that this wouldn't work because there was some extraterrestrial disease where all of a sudden, the normal parameters of yin and yang don't work. And the patient was exclaiming immediately with just one needle into PC6, oh my God, my chest is opening up. And so he said, his chest opened up, and he said, my heart opened up, and our whole team opened up, because we were confident that our bread and butter techniques, this is business as usual. And so that's the important thing to emphasize here, is that you imply your regular measures, it'll work just as well and immediate as as normally. What else do we have?
We've got lots of thanks coming through, people that are glad to have the community. We appreciate you. And let's see, Zachary Corbett asked a two-parter right at the beginning. And I don't know what your experience has been with this in particular, Heiner. I know it's a syndrome differentiation thing as much as it is a COVID-19 thing. But he asks, what time do you expect to achieve results? And then what degree of clinical change can we expect with our approaches?
Okay, the important thing too, and again, this is in Liu Hong's report, he's reminding us to not have we want to have nothing but the greatest respect for the immunologists are working hard in predicting course of the disease, educate us about spreading of the viruses, social distancing, when to wear, necessary to wear a mask, how to disinfect surfaces and why. All of this is great. And then, of course, people working day and night until they fall over, both in China as well as now in New York, and probably even here in the emergency room in Emmanuel and Good Sam's, et cetera, in Portland. It is the reality is that antibiotics do not work for viruses. Antivirals that exist at this point do not work for this particular virus. The HIV antiviral studies have failed. The other kinds of antiviral stuff fails. The regular flu remedy like Advil and ibuprofen, those kinds of things, they make things worse. When they were in the hospital, all of the patients in there basically been there for months and haven't gotten better, and we're losing hope. And it wasn't until they started doing acupuncture and Chinese herbs where there was an immediate improvement, where then the patient's psychology started changing. And they were like, wow, there's a light at the end of the tunnel. Maybe I'm not going to die after all, because this is the, so there is immediate result. I particularly believe that the anti-stagnation herbs, and Chaihu belongs to them, they prevent the virus that has these sticky, right? We see these images, the, right, this kind of, this called coronavirus because it has this crown-like spikes on it that I guess under the microscope, the virus looks that way, as if it was wearing a crown. This is enabling it to stick and adhere to tissues and be incredibly tenacious. And I think these basically Jiajian Suhetang, thunder lightning approach is, among other things, you know, we're using that for Lyme disease normally, it works with biofilm. So I think this virus is also benefiting from the presence of biofilms, or may even be secreting that itself. And so by moving the qi, or harmonizing the shaoyang with herbs like chaihu, and probably cinnamon may be doing the same, and aromatic herbs like, you know, fumigating the system with Lanisra, forsythia, red atractalodes, amomum, cardamom, etc., patchouli, those kinds of herbs, they are preventing these sticky tentacles of the virus to stick. And then it works rather quickly. So people having high fever, the fever will come down within 24 hours. But caveat is you need to really dose it higher than you normally would, number one. And then you can't immediately, wow, this worked really great, I'm doing better. If it's really this particular virus, that's what happened in China a lot that they call this fuyang, which is short abbreviated term for testing positive again. You know, people get only released from the hospital because they might still be coughing a little bit, but basically testing negative for the virus. So out of quarantine, be released, open up the bed for the next patient, but then all of a sudden they keel over again and either test positive again, or they keel over and die, even though they were declared cured already. So it's very important to stay on top and keep treating people. And I also want to, you know, we can't finish all of this because what we are doing, and at classicalpearls.org is to open up a forum for people who want to work with these more simple patent remedies, and want to ask exactly these questions once they're already in the middle of treatment. You know, what do I do? How many do I use? When do I stop doing that? So if you're interested in that, you just, you know, this is of course for legal reasons. We can't just go on Facebook and then, you know, we don't want to promote, we are curing, right, COVID, you know, that politically is an issue, but we are licensed very often doctoral level with thousands of hours of training, and we certainly treating pneumonias perfectly within our licensing parameters. So we not only can but should be on the front line treating this disease. But if you have unsure and you have difficulties, then and you're interested in that, I personally will spend several hours online in some kind of segregated forum, practitioner support forum at classicalpearls.org. The only thing is you need to have be signed up, have some kind of a sign up as not a member, but I know what it's called to need to be approved there as a practitioner, exactly. And so we can have a behind the scenes websites where we can have these discussions that are not open, that are open to licensed practitioners only and not to the general public.
I know a few people have been asking, how is your stock doing? So some of these formulas you've been mentioning, I'm sure, are now going to be flying off your shelves. So how are you doing in terms of some of these that are fighting these types of syndromes?
Yeah, this is another excellent question, very relevant. It's about the stock of Chinese herbs in general. Let me start answering that. Some of you have already discovered you want to order Shogan. No company carries those granules anymore. We, of course, can't get Ma Huang, which played such a big role in China, or at least in the Qingfei Paidu Tang approach. I think the Ma Huang is probably, that's okay, not having that. Shogan Belam Kanda would be nice to have. Baidoko is already out. But again, the nice thing in Chinese medicine is you don't have a one herb approach, and once that herb is out, again, it's the fa, so it's the methodology. Okay, we want to resolve. If we don't have patchouli, then what other herb can we use? Angelica, for instance, baiju. Can we use that? Absolutely. How about zisuye? Absolutely. If that's out, can we use zisuzhe? Absolutely. So it's just a direction that is important. And that's an advantage of the, thunder and the lightning, particularly for practitioners who are somewhat worried, oh my God, what if is this stuff toxic? People on Western drugs already, those have bland kind of herbs in it that are sort of middle of the road, that are not too hot, not too cold. There's no aconite in there. So we are, they are, even for children, safe. So that's why I'm encouraging you to start prescribing and getting your feet wet. So I haven't kept up, I know that some of these herbs that are so touted in the Chinese studies I've mentioned so far, some of these have already disappeared from the shelves, single herbs from the granular companies, but again, you can replace them with others, and they're probably feverishly working on getting more. Be prepared for price increases, however, since it's not that these people will gouge you, but particularly at this time, it's simply that the herbs are like stocks in China, and you can't make more. The harvest might be in the fall, and the people who still have some, they then sell it at a much higher price. So like Jinyi for instance, honeysuckle, I just heard yesterday when I was reordering the thunder pearls, which I think is the most important remedy from the Jiajian Suhetang version right now for preventative purposes at least, and then maybe part of the early approach. Classical Pearls still has 10,000 bottles in stock. We are still limiting it. We thought we had a 2-year supply, but now we're thinking we might run out in July, and we'll get them in time, even if we sell them at this rate. I think we're okay, but just dumb luck or so, because we produced so many new remedies in the new heritage line, like Xiao Chaihu Tang, Yin Xiao San, Chaihu Guizhi Ganjiang Tang. So we have all of them freshly in stock, and then usually lots of thunder and lightning. I possibly we'll run out of shortly for like 2 weeks or so until we have it then again. I think it just landed in Seattle yesterday, the new powder, but it takes a while to get it into the bottle. So we'll work hard on that, and then we'll be good for a while. So as far as classical pearls formulas go, it's the best possible scenario. There should be plenty, not to supply the, if all of a sudden there was like the average person would want to stockpile that at home, then of course not. But for the still small profession of Chinese medical practitioners, particularly those within that, the even smaller percentage of people working with classical pearls, I believe we are in good shape. And even if something runs out, we will update and say, well, we don't have this, but use this instead. That should work just as well due to the principles that I mentioned earlier. And I believe I was just in contact with Cindy Mickler up in Washington State from the Lotus Institute, and they're working really hard to kind of bringing the profession together and have people sharing information and getting all of the companies on board to make sure we have enough supplies. I was glad to get a call from the factory in China that makes our remedies, who said, we're in this together, and we will do everything that we can to immediately produce something if you think you're going to run out, which is not normally the case. So I think that the thing to be afraid of right now is that there are no airplanes really going. I think right now there is one airplane from the entire country of China to the entire United States per day. And so it's virtually impossible to get herbs on the plane for the next 2 weeks at least. So that is the difficulty. But from a production perspective, the factories in China, at least our factory, is running again, and we'll do our best to. And we've got plenty of stock here in Portland, so hopefully that'll work. And the folks at the distribution center are amazing team, and they've opened up. They're working through the weekend and hired 3 new people to make sure that they able to deliver stuff the next day at the very latest, rather than, we 1 week behind in orders or so. Are we done, or do we have more questions?
That's really up to you, Dr. Fruehauf. If you want to take 5 more minutes to do more questions, you can. There are quite a few more questions still out there, but I definitely encourage people to get on your webpage, on your practitioner forum, and I bet those questions are maybe even already answered there, some of them.
I feel I can't see you guys anyway who's on there. I only see about 3 or 4 people, so you don't need to feel embarrassed to click out of here, but I'm most certainly willing to stay to answer another 1 or 2 questions that Ross thinks are important. So I'll be here for another 5 minutes or so. Otherwise,
okay, 5 more minutes it is. Thanks so much for your time.
In there and be in touch, and I'm happy if the OAOM needs me to come back, or if there might be a different situation a week or 2 from now, or I'm willing and happy.
Speaking of
unless people find that's useful to talk about this again.
Speaking of a week or 2 from now, we're going to have Guohui Liu do a 2-hour presentation. I believe it'll be 5 to 7 a week, 2 weeks from today. We may be doing a telehealth webinar a week from today if we can find someone good and qualified. We've apparently those people are in high demand right now. We've been having trouble finding someone. But there were a couple of questions, Dr. Fruehauf, about autoimmune presentations coming up with COVID, as well as neurological effects that come along with it. I know that's a complicated situation, but can you talk on those two, autoimmune and neurological, coming along with the COVID-19 symptoms?
The interesting thing, you know, that as somebody who's somewhat specialized in the treatment of neurological diseases, particularly together with autoimmune disease, because that's of course what happens with Lyme disease, is you have this stealth invasion that then your body feels over challenged by and starts overreacting in the form that we then call autoimmune disease. And 1 minute it's Hashimoto's, and the next it's Baker's cyst, and the next it's some other kind of autoimmune issue, lichen sclerosis, etc. That is exactly like myocarditis. In the aftermath of a severe cold flu, that is exactly what we see here. So I feel familiar with this kind of progression, and my hope is that people are willing and able to recognize that even in non-COVID patients in the future, and see the benefit and look for that kind of complication, because that does happen more often than not, I find, than particularly when people get heart palpitations, irregular heartbeat, etc. And that is, of course, what thunder and lightning pearls are treating, is these complications due to spirochetal infection or chronic, like for instance, Epstein-Barr infections. And the interesting thing is that I had a student here, who's just in the first year, felt emboldened to give thunder pearls to his grandpa, and then saying he's been having all of these problems, and he's not sick or anything, he's just taking it prophylactically, but all of a sudden, all of his high blood pressure is down, he could cut some other medication, you know, because he's 80 some years old, has all these orange bottles, was able to cut some other medication in half, because of course a lot of people are inflamed and a lot of people already have these complications and they live with that. And then all of a sudden they're taking a remedy because they're thinking preventatively for this other disease, you know, instead of thinking, oh my God, I'm going to use Chinese herbs and I don't feel familiar with that and I'm going to poison somebody. You should be thinking there might be a lot of benefits that come out when people who technically don't need herbs because they not infected yet, but then actually they chronically inflamed, and they then get benefit from this very broad spectrum kind of an approach. So I think thinking like that is important, and yeah, that neurological, and of course Shaoyang means neurological involvement. You know, Taiyang, the nerves, if you had to classify them somewhere, it's somewhere in this Taiyang Shaoyang, you know, triple warmer, gallbladder, bladder channel. Those are most responsible. You know, if the nerves from an anatomical perspective are governed by these three channels. So it makes perfect sense that if, you know, we will harmonizing just the Shaoyang means we are driving the virus virulent influence out from the nervous system. Good enough for today?
I think so. We don't want to take up any more of your valuable time. We really appreciate you coming and doing this for us on the behalf of our members and even some non-members, and even at least one non-acupuncturist I think I saw on the feed. Hi, Marilyn. Welcome everyone, and thank you so much. And we're going to have Guohui Liu in 2 weeks, and we always love having Heiner. Maybe we'll have him come back again once this thing's settled down just a little bit.
Thank you, Ross, very much. And thank you guys very much.